feed Cross River State as we're shutting down on activities.
All right, Dr. Edu, it's interesting to see that the governor is really being strategic with his approach, even though there is no case reported yet in the state. But with regards to the no mask, no movement order put in place, you would recall that the NCDC has said that the masks are not really necessary except for persons who are sick and those who are managing them. How do you reconcile both positions?
Okay, so it's very simple and easy to understand. For us, masks is important if you're going to public places. I'll give you very clear scenarios. People go to the market. Of course, in our African tradition, you would hardly be able to practically keep people away from themselves. We've been preaching over months for people to physically distance themselves from others. We've been preaching for months, no public gathering. Of course, there's a ban on public gathering in Cross River State. No church, no mosque, no prayer house, nothing. People should stay at home. Schools have been closed. No public gathering, good. But then every day you pass on the streets and you see people who cannot even keep 1 meter away from each other. You find people who have difficulty in keeping social distance. Get the point. The point is everybody needs to wear a mask. Imagine that you have a mask on and I have a mask on, okay? If I cough or I sneeze or I speak out loud, of course, the micro droplets that come out of my mouth, of course, you know the normal physics, the traveling with distance, the velocity. It comes out of my mouth depending on the force with which I sneeze or the force with which I cough. Sometimes it might go beyond even the 1 meter which is recommended. At other times, remember, people might not be able to keep that 1 meter social distancing. So it's not practical at that point. And then you see a barrier which can completely hold in these droplets, micro droplets and the rest of them within you. Saying the surgical masks and those ones can be used by the medical practitioners, and we're keeping it for them. Health workers, we're keeping it for them, those who are intervening in isolation centers and the rest of it. But Cross River State as a state is locally developing its own masks to distribute to people to wear. If you're wearing a mask and I'm wearing a mask and I sneeze, of course, all of the droplets are being contained within myself. And so it has very slim chances of coming out to go to the next person. Let's imagine that for any reason, very little micro droplets leave my own mask and you have your own mask on. Remember that automatically you're shielded because the velocity, it would have lost some velocity and it would be unable to move into the next person's nostrils or their mouth. It's just important for us to understand that in our African setting, it's very difficult, very, very difficult to achieve social distancing. And that's why you see officers, even the NSCDC, even government officers at the national, when they go for meetings, you see all of them wear their face masks, even though they are observing social distancing.
Now, the aspect of social distancing is even something recommended by WHO, which it says is very, very, very important. I mean, if that is not important, wearing the face mask, I wonder how people, because WHO has said that that has to be enforced whichever way possible. I mean, and the governor is saying that social distancing is not important. Is that what you are also saying here as well this morning, looking at the fact that WHO has said that we should, as much as possible, ensure social distancing?
So nobody is against social distancing. What we're saying is that we're providing a more reliable form of preventing this disease from going from one person to the other. At this point in time, Nigeria is faced with community transmission. So you can find a person who has a positive case, and you cannot find any link between that person and someone who was previously tested positive. You can't find any link between that person and someone who has traveled out of the country. You can't find any link between that person and a previous case. At this point where we're having community transmission, where people do not even know where they're picking the disease up from, it's important that we go an extra mile and see that we can use our face masks. I want you to check out countries. Okay, you can use Czech Republic, for instance. It's in the middle of Europe. Europe has recorded several deaths. In fact, the UK is recording close to 1,000 every other day. Italy has gone out of the blues. You know what that is already. But Czech Republic is right in the middle of it. What are they doing differently? Of course, they are taking up into perspective social distance, and every other UK country in Europe is doing the same, like UK and the rest of them. They are doing the same. But what's different for them? They're all using their masks. If you must go to public spaces, you should use your mask to be able to at least contain whatever is coming out of you, even though you are speaking loud, you're sneezing, you're coughing, to contain it within yourself and don't let it get to the next person. So for us in Cross River State, the no mask policy, no movement, no mask, no movement is sacrosanct, and we'll continue to do it. Prevention is our #1 step. And
Dr. Betta Edu, we have to leave the discussion at this point. Thank you for speaking with us.
Thank you so much.